To set up an arterial line, you'll begin by getting all of your equipment together. You need the SafeSet arterial line tubing. You need a 500 cc bag of normal saline, a 500 cc pressure bag, along with your cable to connect your arterial line to your monitor. To begin priming our tubing, we want to first orient ourselves to the setup. So take everything out, the white packaging comes off, lay your tubing out, and we want to make sure that all of our connections are tight. Great. Set aside your caps. We'll be replacing these as we go through. The white caps come off and the yellow caps go on. Quick review of our stopcock. Labeled on this arm is off with an arrow. Whatever direction this arm is pointed, the system is off to. Off to the patient, open to our transducer and our bag of fluid. Our system is now open to read pressure. Now, we're gonna spike our bag of fluid. We wanna burp the air out of the bag so that we have no air in our system at any point after this process is done. To do that, you're gonna first turn your stopcock off to the patient, to this end, and we're gonna take this white cap off. Open to air. We're gonna apply pressure at the bottom of the bag to get any air in the bag to the very top here. With your roller clamp open, you're gonna depress our flushing mechanism and watch as it sucks the air out. We only wanna fill our drip chamber about halfway, and that's just to allow us later on as we flush the system to make sure that fluid is flowing through. Sometimes you can have clots on the end of your arterial catheter that can prevent it from properly flushing. With our stopcock continued in this off to the end orientation, we're going to continue flushing. Saline's gonna come out of our port here, and we're gonna look to make sure that we have no air up until. It's particularly important to look at your transducer to make sure that there are no air bubbles in this area, because this is where your blood pressure reading is done. Now that the air is bled out of the system, we can take our white cap off and replace it with one of the yellow caps. This is particularly important because the white caps have a hole in them. The yellow caps make it a closed system. We're gonna move our stopcock off to this yellow cap, so the whole system is now open and we can continue flushing our system. At this point, I'm gonna go ahead and put my bag into the pressure bag. Again, with our stopcocks, there's reminders here as to which direction to put it. We're going to push it off to this appendage and inflate it until my gauge here comes up to green. This takes a while. Once we see green on our gauge, we're going to move our stopcock up off to the bag to hold the pressure here. This is going to make the rest of our priming really efficient. For the next step, we're going to have our SafeSet pointed up. The rest of our stopcocks can remain in the neutral position. Again, depressing our flushing mechanism here and waiting until saline comes out of the end of the system. I'm gonna do this for a few seconds and then visualize on my tubing that there are no bubbles. Lastly, I'm gonna change out my white cap for a yellow cap. And now my system is ready to be attached to the patient once the provider inserts your arterial line. To set up and zero your system, you need to locate the gray cable, which will connect red end to the red pressure port on your monitor. Little tip, there's a raised line here. That's gonna line up with this little dot here. And that makes sure that all of the pins go into the right hole. The other end is going to connect to the jack on the end of your art line. Arrow lines up with the line, clicks in. Once you have the gray cable connected to your art line tubing, your monitor is going to automatically detect it in red here. Next, what we're going to do is zero our tubing. We want to align our transducer with the patient's phlebostatic axis, which is roughly mid-axillary line, fourth intercostal space. Some departments have holders. If you don't have a holder, you can simply use a piece of tape across the transducer to a blood pressure cuff or to their arm. Never tape this tubing to the bed. It should always be with your patient. A reminder to orient yourself with the tubing. One side of it is a little bit bigger and more flexible. The other side is thinner and a little stiffer. Big to bag, the thinner tubing to patient. Once it is connected to the patient, we are able to zero the device. On your monitor, there are two ways to find this. Clicking on your waveform here and scrolling down to 0 ABP, or down at the bottom, scrolling over 1 to 0, which will give you options for any pressure cables that you have attached, 0 ABP. We are going to turn the system off to the patient, open to the transducer, open to air, and press 0. You'll hear one beep and see a dialog box that says the 0 is in process. And then you will hear a second beep that will say 0 done with your timestamp. Replace your cap, return your stopcock to the neutral position, and identify your waveform, performing square wave test and comparing to previous blood pressure measurements. To obtain a sample of blood from your art line, the first thing we want to do is silence the alarms on our monitor. Because as you do this, the waveform is going to be thrown off and you're going to get a lot of alarms. With our stopcocks in the neutral position, meaning that there's an open reading from the patient all the way to our system, we're going to depress the safe set device and slowly pull back to the 10 cc mark. This provides our waste without actually wasting any blood volume from the patient. Once you're at the 10 cc mark, come down to your lowest port and turn your stopcock off to your safe set syringe so that your sample of blood will come directly from the patient. You're going to clean the hub, and then attach your syringe and withdraw your sample of blood. Once you disconnect, return the stopcock to the neutral position, and slowly we're going to push our waste volume back into the patient. When you get to the bottom, you want to squeeze the arms here and push them down until they lock. There's 2 little plastic ridges that will make it so that this is locked in place. You'll still have blood in your tubing. At this point, we want to come up here and flush our system using pulsing motion until there is no more blood in the system and your line is clear.